Welcome, everybody. Glad to have you along on Health Talk this morning. I am Peter Christian. John King is right over there. And joining us here in studio is Executive Director of the Missoula.United Way, Susan Hay Patrick.
Good morning.
How are you?
Thanks for having me back.
I haven't seen you for a while.
I know. I've missed you.
Yeah, well, we've missed you too. So, now I understand that you come today bearing a very special message. So what's going on?
Yes. Today we are unveiling a major suicide prevention initiative called Project Tomorrow, designed to shine a light of hope on issues surrounding mental health and the public health crisis that is suicide in Missoula and in Montana. You may know that we are number one in the nation for suicide, and the suicide rate in Missoula for the last 2 years has been at a record high and is on track to be at a record high for the third consecutive year. We must do something about this, and Project Tomorrow is an effort to do just that, to spread awareness, education, and hope to families throughout western Montana.
What does the initiative entail?
So, two things. One, 2 years ago, United Way and some other community partners founded the Western Montana Suicide Prevention Initiative, a collaboration of nonprofits, businesses, veterans organizations, the university, Missoula County Public Schools, to basically get everybody on the same page regarding suicide prevention. We knew there was a lot of good work being done in our community on suicide, but nobody was really sitting at the same table on a regular basis, identifying gaps in our suicide prevention work and figuring out how we can mutually support each other and go forward like a coordinated SWAT team rather than like lone firefighters.
The biggest question I have, and this is always plagued me. I just have never understood, what is it about Missoula that makes us the focal point of this terrible statistic?
You know, that is a good question, and I think it is.
Does anybody really know?
And there are many. It's complex. You know, it's so ironic because we know that suicide is the most preventable form of death, yet our rates continue to be at a record high. So there are a number of theories. The states that have the highest suicide rates are generally rural. They are generally lack access to mental health care. So all 56 Montana counties, for example, are mental health shortage areas. So even if one wants to seek help, sometimes there are barriers to doing so. We have a high rate of gun ownership, and easy access to lethal means is a known factor to contribute to suicide. And obviously, gun ownership is an important Montana value. We just want people to keep their guns secure, especially if somebody in the home is depressed or at risk of suicide, because it is such an impulsive act. We know that we have a culture that we're a tough, proud people as Montanans, and
we're rugged individuals.
Rugged individuals with a high veteran population, and we need to normalize seeking professional help for family, personal, work problems, just as we would go to the doctor for the cold or the flu. We need to normalize that for depression and mental health issues.
If I'm not mistaken, the segment of the population most at risk for suicide is one of those segments that's most adverse to getting help. It's older males.
Yes, men 35 to 60. And that is the demographic that tends to take their lives most often in our community and our state.
What I have read is that especially the men who range from 40 to, say, 65 are men who have had a career, had a successful career, something happened, a business, a factory went out of business, or some sort of, the Great Recession that moved through in 2008. Hundreds and hundreds of people, when Smurfit Stone shut down, there were 700 people out of work just like that. And what I have read in other parts of the country is that these men, they don't want to be a burden to their families because they can't seem to find a job to be able to provide the same kind of living that they had before. And so they feel like they're a burden on their family. Everybody else has to go to work because they can't find a job. And it just hurts so bad for these men that they, first of all, they think, I'm never going to get a job again, even though there is training.
Right.
In other words, they can't see the possibilities because of the
they
pain
can't
they're going
see the
through.
tomorrow.
Right.
And I think there is a lot of anecdotal evidence that supports just what you said. We also have one of the country's highest per capita populations of veterans. And, you come out of the military and you have to find a new place in the world.
Right.
You're commanding platoons and doing all kinds of important work on an urgent basis with camaraderie. And then kind of you often can feel adrift and not finding your place and like you're a burden to your family. So there are many complex reasons, but I think what our message is that suicide is never the only option, that preventing suicide is everybody's business. We offer strategies that people just like you and I can learn to recognize suicidal tendencies and signs of suicide in our family members, friends, and colleagues, and take action to help them, to reach out with help and hope.
Now, the Better Tomorrow initiative.
Project Tomorrow, but I like it. I like Better Tomorrow too.
Got it. I think I'm on Better Together from the campaign. So
also
the
true.
Project Tomorrow initiative. Is that something that it sounds to me like a round table where you're just trying to get people to talk? But I mean, is there money behind it? Is there feet on the ground?
No, it's two different things that we're announcing today. One is a rebranding of the Western Montana Suicide Prevention Initiative. That term doesn't just like trip off the tongue, right? It's a cumbersome name.
It trips when it's on my tongue.
We call it WIMSB for short. But when we really looked at how we wanted to amplify our efforts, especially as we enter the holiday season, because suicide rates in our community spiked in January of 2014 and 15. So there's some sense that people got through the holidays and then the pain was too great and they didn't see another alternative to completing suicide. So rebranding WIMSB into Project Tomorrow, and at the same time launching a major multimedia campaign to encourage people to reach out for help by calling the National Suicide Lifeline and using the National Crisis Text Line. Young people especially are more inclined to seek help via text message than by calling a number. And both these programs, the National Suicide Lifeline, which is 800-273-TALK or 273-8255, and the Crisis Text Line, if you text MT to 741-741, these are proven effective organizations and resources that can that are available for people in need. So if you or someone you know is at risk of suicide, you need to reach out to those outlets.
And with that, we're going to take our first break, and we have 4 phone lines open. Now, I realize this is a difficult subject to talk about, but if
we can't fix things if we can't talk about them.
So if somebody in your family has had this terrible tragedy, and you would like to share your message with the rest of our audience, we would love to hear from you, okay? Because all you can do is help somebody else to keep from making that same decision. Our number is 721-1290 or 1-800-568-5309. You can also make your company don't want to be on the radio. You can send us a Facebook message, and we'll be happy to share that as well. We'll be right back. All right, here we go. We're back. 721-1290 is our number, and we're talking with Susan Hay Patrick from the Missoula United Way, and talking about a very, very serious topic about suicide prevention, a brand new initiative just being launched today, and we do have a caller. So grab those headphones, and we'll get Larry on the line. Larry, good morning, and thank you for calling Health Talk this morning. Hi.
Yes, good morning. Good morning, Susan. This is Larry. And I had a question. I didn't hear who all was involved in your roundtable discussions, but do you have any folks that have actually contemplated suicide or been very close, and to find out what triggered their...
Right. That's a great question.
I think,
go ahead.
Just one more thought. Is it, if you're going to have a group that hasn't experienced it, you may be looking for solutions in the wrong area, but if you have somebody that has on your panel or your group, that would certainly possibly lead you in the right direction as far as what prevents that.
Right. That's a great point.
Thanks, Larry.
And We do have, it's a tough thing to acknowledge in a public way, I think, if you've had thoughts of suicide or attempted suicide. But I do know that we do have people involved in our initiative who are both survivors of suicide, the loss of a loved one, a child, a parent, a sibling, a close friend. And we do have people who have seriously contemplated suicide. And we have some very important voices of young people. There's something that disturbs the order of the universe terribly when a young person takes his or her own life, and we need to figure out how we could have intervened and reached them. But let me just say another thing.
Go.
I think all of us, at some time or another, have experienced periods of great darkness where we haven't necessarily, and myself included, where it would never have occurred to me I don't think it ever would have occurred to me to take my own life, but I did see how I did feel it was very hard to go on, and I could see why people did complete suicide. So I think if we speak about that and about our own experiences, I think everybody I know has been depressed or felt despair at some time or another. And in fact, national studies show that most of us at one time or another, it's a normal thing, believe it or not. What we have to stop is people following through, making a plan and completing.
So we are in this situation where we're expecting a spike in suicides in January if the trends follow what happened last year. And we're also going through a month of holidays. We've got December here. Christmas is one of the big celebrations of the year for most folks. And lots of families going to be coming together. What are some of the signs and symptoms that we might be able to recognize in our family members that might lead us to ask questions?
Yeah, I think feelings of isolation or despair, not talking about the future, sometimes giving away possessions. Sometimes there is, you and I were talking about this off the air, there is a sense of lightness among people who have made a plan. So if you see that in somebody who has been depressed, sometimes it's a call for increased vigilance rather than just, he or she must be feeling better. What is so important is that if you have any thoughts that someone in your circle is seriously depressed, you must ask the question. You must ask them, are you thinking of taking your own life? And you must reach out a hand to offer hope. And I would say to anybody listening who is feeling depressed or suicidal, people in your community care. They want to reach you. They want to reach out a hand to help. Help is available.
Here's the perception, okay? And there's an old saying, it's not what I think, it's not what you think, it's what I think you think, okay? That forms our perceptions in many ways.
Mm-hmm.
People who let's say I've been really depressed and you come to me and say, oh, gee, Peter, what's going on? Are you thinking of committing suicide? Well, the person who feels that way feels like they're damaged goods now, that it doesn't matter what happens from here on in. Oh, he once contemplated suicide, so we got to keep an eye on him. All that, you know what I mean?
Right.
And so how do you overcome that stigma?
I think that we, as I said earlier, we must normalize seeking help, and we must not do anything that makes people feel like it's a sign of weakness rather than a sign of strength to reach out for help. And I think that is one of the goals of Project Tomorrow. And studies of people who have attempted suicide and survived say that just one person reaching out to them made a difference. There's a study of people who survived jumping off the Golden Gate Bridge in San Francisco. Obviously, there are not that many of them, but they say some interesting things. One, every one of them said that the minute they were in the air, they regretted the decision. And number two, that if somebody had stopped them while they were standing on the bridge or walking on the bridge and intervened with them, it is in all likelihood they wouldn't have tried to jump. So again, normalizing and letting people know that it is a sign of strength, that people care, that things will get better, that tomorrow can be brighter than today, giving people a sense of hope.
Let's get a phone call in before we take another break. Candy, you are on with Susan Hay Patrick. Go ahead.
Yes, I have an issue with this normalizing suicidal thoughts and ideation.
No, I'm saying normalizing seeking help.
Yeah. But if you get rid of all the antipsychotic drugs and that people are on from youth on up, I think we will see the problem take care of itself, because the use of those drugs is, I think, the predominant problem. In alcoholism, that's a problem in our society, and it's a problem in Missoula because these kids, the first drug they use is alcohol to numb themselves. And then they go on to other drugs like meth.
Real quick, Candy, do you have a question for Susan that she can answer?
Yeah, get the kids off the drugs and see how that works.
Okay, thanks.
Yeah.
Thanks for the call.
That's more of a recommendation, but whatever. My question for you, though, to tie off with that, is that it is my personal experience from dealing with people close to me that have been suicidal in the past, that the tendency for suicide that does accompany other addictions oftentimes, including alcoholism.
Yes. Alcohol is present in a great number of suicides in our state.
And I think Candy was definitely onto something with the self-medication or the kind of the numbing sensation that you get from many drugs, including alcohol, of course, if you're over-imbibing. I guess if I were to recommend someone that was looking for warning signs, I would say, if you see someone in that kind of state, long periods of time, it could be an indicator of suicide.
I think that is a really great point. Just, and I neglected to mention it earlier, but substance abuse, pain numbing through alcohol, prescription drugs, isolation.
And it's especially important, too, that it's not just alcohol. People abuse drugs they get over the counter, especially older males and adults. I mean, a lot of them have experienced pain, have pain medications that they've become addicted to. It's something that happens.
We're going to come right back.
Okay.
No, we're going to come right back. Finish this up. 721-12. We only have a half an hour. That's the fun. We'll have to have you back. 721-1290 on Talkback. 721-1290 is our number if you want to talk with Susan Hay Patrick. We'll be right back. Gosh, where have I heard this before? 721-1290 is the number. We've been rickrolled. All right.
We have to give up Susan Hay Patrick here.
Yes, we do. We only have about 2.5. So real quickly, take us through this here.
Yep. Can I just say one more thing in response to our last caller, that there is a strong correlation between chronic pain and suicide, that 20 to 30% of those who die by suicide have issues of chronic pain. This is on a national basis, and a person with chronic pain is at much higher risk of suicide. So are those who have survived the death of a loved one by suicide. They are immediately put at higher risk. So those are just some of the many challenges that we face in alleviating what really is a public health crisis in our community. Let me just say that if we've had 68 suicides over the last 2 years, we've had 30 so far this year by the end of October, so I suspect we may be at an even higher rate. And if any other single cause, we're taking about 100 of our family members, friends, colleagues over a 3-year period. If it were car accidents, if it were a murder rate, this sudden, inexplicable, terrible loss, we would stop at nothing to bring every resource we possibly could to bear to end this. And that is exactly the kind of passion and dedication that we need to bring to suicide. So Project Tomorrow, which we're launching at a news conference today, is an outreach campaign and a rebranding to really amplify and raise our game as we address this.
I feel really cutting edge to have Project Tomorrow announced today on Talkback. I feel like we're ahead of the curve.
Lucky I wasn't here yesterday.
Yeah. This morning, yeah, exactly.
And two things: if any of our listeners feel suicidal or deeply depressed, or know people in your circle who are, please encourage them to call the National Suicide Lifeline, which is 1-800-273-8255 or 273-TALK, or text MT to 741-741. You will find help.
Now, what if it's one of those situations where the person in trouble you feel just would have a hard time talking to someone they do not know, or someone that's over the phone, or the distance is part of the problem, and a national hotline might not be the best solution?
Sometimes it is easier to talk to a stranger, but oftentimes it is easy to talk to a friend. That is why it is so important that we give people the training and skills they need to reach out to people in crisis. So I would just say, I would encourage people, if someone in your circle is depressed or you think is suicidal, deeply depressed or suicidal, ask them the question, talk to them, reach out a hand of hope, encourage them to seek help. Call 911 if you must, if they've developed a suicide plan.
Are there local crisis centers in Missoula?
There are lots. Please go to, later today, please go to projectmontana.org to see local resources. And you can also call 911.
We are out of time.
Thank you so much,
thanks
gentlemen.
For being with us, you bet. That's Susan Hay Patrick, a part of Health Talk, brought to you by Community Medical Center, and we will see you on Talkback in just a moment.